All right. Well, welcome everyone. It's Monday, the last day of February. I have no idea how we got here. It feels like it was, a minute and 30 years all in February. I'm Tennille Wetherell from Office of Enhancing Student Opportunities, and with me today is Scott Nine, and Kati Mosley is here as well from our leadership team. And we also have Leanne Baker and Michelle Goodness and Hayden Burnell, Kathy Metzger, other ODE teammates here, Joanne in the chat to provide support and information for us as we move through our day. As you know, that we're here to provide clarity around Ready School Safe Learners. And I hesitate to say clarity today because what I need to help you understand is that a lot of shifts are happening, right? We know that something amazing happened again today, and there's probably less information that we can say for certain today than usual. So we're going to ask for your patience as we know you're itching for real concrete information. We'll tell you what we know, but when we say, listen, we're not sure yet, that hasn't landed yet, we're not able to answer that. We're just going to need you to take that deep breath and be with us in this really hard moment, and know that as soon as we can communicate it, we will. So just throughout the day, if we're unable to answer, we'll let you know. And if we can, we will. Go ahead, next slide. So Scott and I are going to be facilitating today. Scott's going to help us with chat and answering questions, and I'll try to facilitate throughout. And we have our chat navigators, and Leanne Baker will be giving the primary presentation. With that, I'll give it over to Leanne.
Hi, everyone. Good to see everyone. We're going to cover a few topics today. Again, I'm Leanne Baker, the school strategist on the RSSL team with Kati and Hayden. I plan to share a few slides today just to get us all framed in the same space before we tackle your questions, sharing what it is we know. So I'm planning to share a little bit about indoor masking, the most recent announcement from the governor's office, then talk a little bit about the emergency order lifting, talk about a few things that CDC released on Friday, and then jump into questions and answers. And so the first thing I'll drop in the chat is the announcement that came out today from our governor's office. So I'll drop that in. I think I'll drop that in. And next slide, please. So this came out at 11 a.m. this morning with declining case rates and hospitalizations across the West. California, Oregon, and Washington are moving together to update our masking guidance. After 11:59 p.m. on March 11th, California, Oregon, and Washington will be adopting new indoor mask policies and moving from masking requirements to masking recommendations in schools. So this is based on current modeling within Oregon from Oregon Health Sciences University, indicating hospitalizations will fall below 400 COVID-19 hospitalizations earlier than anticipated. And for the first time, Oregon has significant population immunity, with more than 82% of individuals estimated immune, with that number rising every day. Even with the CDC's recent announcements on Friday about lifting mask requirements on public transportation, the state policy for this still includes masking until March 11th at 11:59 p.m. Next slide, please. So since OHA announced in early February the intent to lift masking requirements, ODE in partnership with OHA have been engaged in a variety of groups to hear feedback. Next slide. Those engagements have been small groups of superintendents, school nurses, reopening advisors, local public health authority personnel, and other key partners, really with the intention of two things: to hear and understand current and predicted implementation challenges related to this shift and to get feedback on proposed solutions for a practical approach to quarantine and other mitigation efforts in settings where universal masking is not in place. This has included discussions on the challenges related to the date for the when local decision-making will take effect. The feedback we heard from school leaders and local public health officials expressed a strong need to keep alignment between dates for lifting the statewide face covering expectations in our K-12 settings with the lifting of the general indoor public space masking requirements. And so school and district leaders told us that they could still thoughtfully prepare and plan for this transition earlier than the end of March. So a hot topic in the COVID inbox last week was related to the announcement about lifting of the Oregon's COVID-19 emergency declaration, which is effective April 1st. Next slide. So this means that House Bill 4402, the limited liability bill related to COVID-19, will likely lift as it applies when the school is operating in compliance with COVID-19 emergency rules. So you can find more information within section 6 of that bill, and maybe a team member of mine can pop that link to that bill in the chat for me. Also, it's important to note that the safety requirements in place regarding vaccination for K-12 staff were not established by the emergency declaration. So instead, they are covered by a state agency administrative rule issued under existing non-emergency state authority. Next slide. So this is vaccination rule 333-019-1030. Next slide. So there are no current plans to change the OAR requiring vaccination for school staff. This is related to our goal to maintain in-person learning. Vaccination helps our staff stay healthy and working directly with students. The OAR requires school districts that grant a medical or religious exception to the vaccination requirement to take reasonable steps to ensure that unvaccinated teachers, school staff, and volunteers are protected from contracting and spreading COVID-19. Many school districts agreed to the use of a specific kind of mask as a reasonable step to protect from contracting and spreading COVID-19. And now with this becoming a local decision, or this always being a local decision, districts may consider options other than a mask to protect individuals with exceptions from contracting and spreading COVID-19. So districts could choose other options like symptom screening, regular testing. Some districts determined the reasonable steps through talks with local unions, and these may be formalized MOUs or other agreements in writing. So if districts do want to change their reasonable steps, they may need to review or renew those talks rather with the unions. Next slide. On Friday, CDC released new information for all states related to recommendations on managing the COVID-19 pandemic, and the shift signals that we are in a new phase. The introduction of the COVID-19 community levels is a significant change, and it reflects a shift in our strategy now that we have so many effective tools to protect us on the individual level. This approach still relies on all of us to protect each other and our communities, and we must ensure that everyone has equitable access to these tools in order to protect our communities. So after March 11th, local public health and others will use or can use COVID-19 community levels in their area to determine what preventative measures to take. Here is a snapshot of Friday's dashboard related to our state and the levels in different counties across Oregon. Green is community level of low. And here, people, households, and communities would take a minimal practical precautions approach. In counties that are medium level or yellow, CDC recommends focusing specific prevention measures on protecting those at increased risk of severe illness. And in areas where the COVID-19 community level is high or orange, a layered preventative measure approach is recommended so that you're not overwhelming local hospitals and healthcare systems by preventing severe illness and death. So here they're saying layered measures means the more steps you take to slow the spread of COVID-19, the safer you will be. So after March 19th, local public health authorities may consider the area's COVID-19 community levels and other local conditions and factors when deciding to implement preventative measures. I will drop the website related to community levels because that is the barest I could give you on community levels. So if anybody has any more information, there's a little bit more about that. So lastly, OHA and ODE continue to be in conversation about landing decisions related to quarantine, contact tracing, isolation, and testing. Our hope is to have the resiliency framework update released very soon, along with the March school health advisory. With that, I think we're ready for questions.
Thank you so much. So the first question is, to clarify, masking will not be required on school buses after March 11th. So a question around school buses.
Yes, so in a complex week of, actually in a complex 2 days of announcements and changes on Thursday and Friday, CDC lifted the portion of the federal, or somebody in the feds lifted the portion of the federal rule that included school transportation in the public transportation face covering rule that was at the federal level. So school buses were pulled from that on February 25th. However, under the OAR that OHA holds around face coverings, both the statewide indoor one, I believe, and certainly the K-12 one, it does still require anyone under 2 to wear a face covering on a school bus. So all of that still remains in place really operationally until that March 11th, 11:59 p.m.
Thank you. Morgan said, we just used, do we need March 19th, March 12th? It's March 11th at 11:59, which is essentially March 12th is the new date. Brooke has a question around if ELD will be making any updates based on this new timeline and recommendations. I know for my office in special education, we are reaching out and working with the ELD to see how those the ELD and EIECSC intersect, but we don't have any new information at this time. Kati or team, do we have anything else update from the ELD side? This is also new. We're just trying to align.
So I don't. I think one thing I will say is we've all been through sort of this timeline before during the pandemic. CDC releases something late Friday afternoon. I hope that we're running out of opportunities for them to do that. Maybe this will be the last one. And then they cascade out additional guidance over time. So for example, more information was released mid-morning our time today. The school's guidance has not been specifically updated yet. We're still waiting on more information on that. And then finally, the ELD guidance as well. So they're still cascading out changes to those sector-specific guidances. And we are in communication with ELD to try to make sure that we can answer or direct people to the best place to get those ELD questions answered, and that we can have clarity around that.
And Jamie wrote in the chat, there's an ELD meeting tomorrow. So that's great timing, and gave some information. So that is wonderful. It always takes a team approach here. Scott?
One question from the chat. Stephanie Walker asks, when will the CDC community level tracker be updated? And if so, on what days of the week?
I don't know. That's a really good question that we can seek clarity on.
Lots and lots of questions around quarantine and isolation and any shifts there.
So there will be more information forthcoming later in the week on that specifically gets at those operational practicalities around that. Again, as I mentioned, CDC is continuing to push out new information related to overall management of this illness in our communities and across settings. So we're working closely with OHA to keep up with those, but to make sure that we are taking an intentional approach to aligning with them and aligning across settings and really getting clarity before we're pushing out more information. So there will be more information on those coming, but we don't have crystal clarity on them yet.
We don't have the time, Pam, for our Wednesday meeting yet. We haven't landed that, but we know folks are wanting to get that on their calendars. So we will be meeting, as Pam's asking in the chat, with some superintendents and reopening advisors on Wednesday, but that has not been determined in terms of the exact time. A great question in the chat around, we can still do masks if we want to, right? And yes, we can. That's a local decision. Everyone gets to decide if within their local context, if they will utilize masks or not.
One from the chat, Tennille, from Patrick. So does the new announcement mean that districts have to do nothing official if they want to go mask optional? It's now the status quo unless decided otherwise.
And what I'm thinking we're meaning is like, do we need to take any official action? Like, does the school board have to vote on it? Or do you have to submit a plan specific to it? And as I understand it, your school district superintendent and board make the determination as to how you process an option like that. Some superintendents have the ability to make those calls without their school board. Some like to take it to their school board. So that would be a local decision. And your next question was, remind me.
I think that was it. It was just that and Patrick, you can unmute and tell us if we answered your question, but I think what Tennille's pointing to is like, because it shifts to local decision-making, your local, like you might be in a district where the board's the one making that choice, and you might be in a decision where the superintendent is, and you might be in a situation where the local public health authority's got something to say about it. So it's not a simple answer. It's a local, it just changes from the state telling you to a local arena. I'm hoping that's clear enough for you, Patrick.
And I think we do need to, however, Kati, make sure that we update our continuity of service plan to the whatever choice the district has.
Yeah, there's
No,
that.
state
And I
return.
think even more fundamentally, I think it's important to communicate clearly to your school community what the pathway forward is going to be, because as we re-embed in this, we are leaning in again to how community takes care of each other and acknowledging that different people in different communities bring different risk levels and risk assessments to how they want to show up in COVID-19. And I think it is really very practically and operationally important that your school communities have clarity on that and how your district is proceeding or how your school is proceeding, and that we take time to create the space for a process of getting used to this new normal. I think about my 7-year-old who I think has had more in-person school days wearing a face covering than not, just because of how long she's been in school. And I want her to have space and grace to move out of that practice as she's ready and when she's ready, and not feel pressured to do something that might raise her anxiety level or cause her discomfort in school. So I do think communicating it out clearly is really important, and to do that by that, before that March 12th, or I guess that's a Saturday if I'm tracking the date. So it would be the 14th. Before that first day, when students and staff are in schools under that local decision making. But Patrick, I see you've come off mute. Do you want to add anything?
I thank you all for that information. It is all very helpful. I think what I was really digging for most was, is this the new status quo that masks are optional? Which, if that is the case, by the announcement, my district could assume that we don't have to take any kind of formal action, any kind of vote, any kind of administrative decision. It is now mask optional unless we decide we want to make masks required. And I was just trying to get through that little line of decision making.
Okay, that's helpful. I don't think that's wrong. I think, not to become a total policy wonk, but I think you could make a policy decision to say that our policy is that masks are optional, and that's part of that pathway of clear communication in your community and with your families about what expectations are. So I know that's a little policy wonky. I don't think what you said was wrong, but it's important to me that we do remain focused on like just supporting community members, supporting kids through that transition with grace and patience for each other and themselves.
Fauci,
Yeah.
I'll add not a policy one, but like a small p political way to think about it. So Patrick, I think if you surveyed 197 school districts, you'd get like 3 or 4 or 5 or 10 very different patterns of how people want to approach this. And so some people might like what you offered as the way to interpret, and other people might go, actually, this is just local decision making, and our local decision is very much that masks are either highly encouraged or required. And the reality is that it's going to look different in different parts of the state. And so it's hard to couch it. Functionally, it's hard to couch it as the state is saying, I mean, the state is functionally, the requirement is removed and it is now a local decision. So to Kathy's point, the bottom line is probably that they are optional. But for some districts, if that's a decision their board took and the board policy stands, it's not quite so simple. So we just need to be careful how we're characterizing it for 197 districts and communities in terms of it's not a flat, simple answer.
Right. I appreciate that. And to be clear, anybody in my position who would not clearly communicate and announce this to the community would be quite foolhardy and short-lived, I'm sure.
Thanks, Patrick.
Glenn, you have a question?
Yeah, sorry about that. I couldn't find the hand raise button on Zoom. So I want to go back to quarantine for a second. I know Kathy just said you guys are going to announce something soon, but this was a big factor for us deciding whether or not we were keeping masks on, right? 5 days versus 10 days is a big deal for us and for families. And so the assumption that we had this morning when we heard the announcement was that it would stay the same. And I wonder if you guys have any idea, because it was going to be the same when it was April 1st. It was going to be the same, I think, when it was March 19th. Are we still going to have to do, if we do not have universal masking, we're going to have to do 10-day quarantines? Because we want to say something to parents, so we want to say something soon, but that's a big piece of information missing for us in trying to make our decision of what we're telling parents what we're going to do.
Thank you so much, Glenn. And I totally understand the connections and the communication that you would like to make. At this time, we don't have an answer for quarantine and isolation. We're hoping to land that as soon as possible and to get that out this week if we can to folks. So we're hearing you, and we know that folks are super interested, but we're just not able to communicate an answer at this moment.
Danielle, a question for you from, well, it's for all of us, but you might be the person for most to answer. So Bruce says, we've got students in our schools, and I think this is like, this is back to that core question of like fundamental principle versus like legal architecture and what's going to play out around different schools. But we have students in our school who are medically fragile. They have conditions, muscular dystrophy, cerebral palsy, Down syndrome. Many of them are unable to wear masks due to their disabilities. Will ODE be providing guidance to districts and families regarding determine if in-person instruction is safe for those students when masking now might be optional? Will ODE be requiring districts to provide an alternative to in-person instruction for students whose medical team determines that in-person instruction is now too high a risk?
No, thank you for the question. And it's one definitely that my office has been thinking about and wondering through. At this point, we are going to work on developing some guidance and technical assistance. But at this point, if masks are optional and it's a local contextual decision, then the IEP team would make a determination based on each individual student scenario. So OESO, ODE, OHA, we're not going to say you have to have this kind of classroom or this kind of option. Instead, the IEP team would analyze the entire situation for that individual child and make the best determination for programming and accommodations and related services as they can for that child. So we'll walk through that thought process, but we won't be providing any additional brand new style of guidance around a maskless situation for students who experience disability. So hopefully that helps.
Unless I'm wrong, and I welcome all my teammates to tell me, we have answered all the questions in the chat or try to skillfully non-answer the questions that we can't answer yet. But I think we have covered everything so far, unless someone sees something else.
Scott, this is Karen from Forest Grove Community School. Can I ask a quick question? I'm having trouble typing in the chat.
Yeah, please, you're
wanted-
welcome. Yeah, go.
Thanks. I just wanted to clarify. I thought I earlier heard, maybe it was Tennille say, hoping to get additional guidance out this week about quarantine, isolation, et cetera. Maybe I misunderstood. I thought I heard Colt say this morning that there would be a meeting on Wednesday at which additional guidance would be rolled out. Time to be determined, but
Yes.
can you tell me what you know about that?
Karen, Colt did say Wednesday.
He's very
and-
confident in you all.
I mean, yeah, well, exciting, right? And I was just being super thoughtful around where that information went to and how it went out and when somebody would receive it, to just say this week. We do intend to meet with superintendents and a group of folks on Wednesday if all things go as planned. As you know, things have shifted a number of times in the last couple of weeks. So we're trying to be thoughtful, and we know that that feels hard when things come out. So we were kind of hedging our bets there. But yes, Wednesday morning is the intended time for that meeting, and the hope is that we get language and communication out to you immediately after, or close
Thank you.
thereafter.
Appreciate it. Thanks.
All right, 3 quick ones that I think I know the answers to, so it's like a quiz. Tennille, I'm going to say the question and what I think the answer is, and then you and Leanne and everyone else will tell me if I have it wrong. Rochelle asks, did the question get answered about the continuity of services plan and when it's due now? I think the answer is still that the continuity services plan is due on March 30th, which was a delay from prior, but I believe that that is still accurately. I got a thumbs up. I'm doing good. 1 out of 1, 1 out of 3 so far. Michelle Cook asks about, is there any information about contact tracing? And my understanding is that there may be more information about contact tracing and the update of information that comes on Wednesday, but we don't have more now. And Tennille, we're working on some internal work to help people kind of think about how that work evolves with this and with OHA and LPHAs. Is there, I think that that's the right answer. Is there anything more to add to that? Okay. And then the last one, Liberty asked a question about volunteers and needing to meet vaccination rules. And my understanding, so the question is, do volunteers still need to meet vaccination requirements? And as I understand it, the vaccination rule requirement is not changed for K-12 schools. And that still means that volunteers fall within the architecture of that, and there is no change. Yes, Leanne, Tennille? All right, I'm happy. Those are the ones we got. Okay, Bruce, we see your hand raised.
Thank you. I want to ask a little more about my initial question. So early in the RSSL, you folks did a really good job and put a lot of effort into equity language to make sure that students who were unable to wear masks were not excluded from school. It was very forceful, and it ensured that we didn't have a situation where if you didn't wear a mask, you couldn't come to school. We're now looking at a situation where because of a student's disability, they may not be able to safely attend. I guess what I'm hoping for is that rather than say it's up to the IEP team, knowing what I know about how those teams may not necessarily have the sophistication or knowledge of you folks, I am hoping that you would have similar forceful and detailed language to tell districts that if a student cannot safely attend, that they need to be provided with appropriate education and meaningful virtual learning if it comes to that. In many cases, the only virtual programs that districts have set up are designed for students who are in general education, and the coursework may not pertain to, say, a student who has both a medical problem and an intellectual disability. So I just want to, I want to make sure that the same force and thought is put into thinking about the reverse situation. Now we will have students who are unable to wear masks, who no longer have the mitigation to protect them of other people around them wearing masks. I'm just hoping that we see something similar. Thanks.
Thank you, Bruce, for the information. We'll do our best to get robust technical assistance out within the limits that we can as a state agency. And hopefully it will provide the kind of supports that you're hoping for statewide.
Tenille, this is kind of awkward, but we'll own it. So we've raised this Wednesday meeting, but I believe the Wednesday meeting is not fully like a wide open invitational meeting. And yet this is a pretty open office hour call. So folks are asking questions about how do they attend and get the preview and the information, but that wasn't really the intent. So we're in that gap. One of the strengths of office hours is that we're bringing private schools and charter schools and public schools and LPHAs and everyone together. But the Wednesday meeting is not, I think, the exact same group, but I'm not in the know about the who's invited to Wednesday. So I can't even give a skillful answer. So
Yes.
Tenille.
I will help you. This
Okay.
morning's meeting was for superintendents, reopening advisors, and charter school leaders, I believe. And anyone who was on that list would receive an email from the Gov Delivery with the information. So if you received it this morning, you would receive it again. If not, then we will route back around to you at the next office hours to give you the information that we know, or there will be a listserv email that goes out providing details and information in written form. Is that
And
still
Tenille,
the gap?
well, yeah, that does, but I think for private school folks, I think the theory, because I do think that I understand and can hear the feedback and we can pass on the feedback that you might feel left out of that. I think the theory is private schools can take information that might come out and have a more rapid, nimble, smaller footprint that they need to move through to be able to prep and scale information to their community. And so the theory of essentially providing districts that opportunity is because there's a few more the scale issues to prep everybody for the kind of speed of turn is kind of the rationale. But I don't know if I know that might not make it feel better, but I want to provide at least a good faith effort for the why I think that happens.
Yeah, and I think also with private schools, it's hard to pivot to what is not required for them versus what is required for them. I know we have a private school team that does provide office hours for private school. So as I understand it, it's a hard moment and that's the process that has been chosen.
We can definitely take in the feedback and loop back and say that and I don't know if it would be fair, but for those of you who are private school leaders on the call, if you are feeling like you need more information about what comes out on Wednesday in some different format or way, we can try to take that feedback and see no promises, but can try to carry the feedback.
Looks like Wendy has a question as well.
Yeah, I mostly just wanted to the group to say thank you very much, because the meetings that you talked about to begin with, the focus groups, Dr. Sutton, you've been very transparent about the science. And I know that once the guidance sort of settles into place, there will be, because I saw someone say in the chat, oh, this isn't going to be great for our schools. I think this is going to be great for the schools, and the nurses are really supportive for the work that you guys have been doing, basing this on science. So I just wanted to thank you for bringing us in, and thank you for the hard work you're doing, because I think that where we land is going to be a really good place for everybody. And so thanks.
Yeah, and if you're following in the chat, thank you, Wendy, so much. And for following in the chat is when is the next private school office hours? And it's Wednesday, March 9th. And there's some information then for you. And I'm not sure if there's a link, if anyone knows, email me the link. Email me for the link. I'll make sure I grab it and get you it. How's that? Jeanette.
And Scott, I just wanted to say, we won't know what we're missing on Wednesday that we'll need to know. So we need somebody looking out. We're just trying to do the best for our kids and provide stability during this time. And we appreciate the openness. We first heard about this meeting, this Wednesday meeting from you. We don't know what it's about. We just would like to be kept in as many loops as possible. And certainly after the fact, if there's things that we need to know, we certainly like to know.
Yeah, I totally hear you, Mark, and yeah, we'll do the best we can. Feedback is clear.
We will do the best we can. And to my knowledge, that meeting hasn't been set. So, so I know that there is intent, but it's not like we don't yet have a time or a Zoom link or anything to share. But
Sure.
we are working with the ombudsman with private schools, and we'll make sure that you have the information.
And there is another meeting like this next Monday, same time, same place, right?
That's correct.
Okay. And that's after Wednesday.
That's also that's also correct.
More information, hopefully.
Jeanette, I see you, and then I want to come back to Anne's question before we wrap up, so we don't lose an important follow-up. Go ahead, and I hope I'm saying your name correctly. We haven't met yet.
Yes, you are. I just wanted to introduce myself. I'm the private school ombudsman. So I just put in the chat the link to the private school office hours on March 9th. And I also put my email in there. So if you have questions around that, you can email me directly about private school office hours on March 9th. But I know they'll be part of the ODE COVID team there, which will be amazing. So thank you.
Thanks for jumping in there. Okay, that was awkward Oregon family style name as we try to sort that out. Okay, Anne asked a question about back on the kind of thread that Bruce raised, and I don't want to lose it. In terms of medically fragile students, could they not update medical protocols to include that staff working with the student must be masked? And Tennille, it just seems like better to leave with clarity before people go on that.
Were you asking me a question? I was responding in the chat and I don't think I heard you.
I was. It's okay. So Anne asked a follow-up to the conversation with Bruce about medically fragile students, and she wonders, couldn't we just update medical protocols to include that staff working with students must be masked? And I don't know if you want to offer any more.
That's an accommodation that an IEP team could consider. And I think that's what feels really hard about these moments and guidance, if you're me, from the Office of Enhancing Student Opportunities, because all children on an IEP are different and have different contexts. And so that's why it's really important that their accommodation be linked directly to their disability and to the concerns and the context of their school and their classroom and their life and environment. But as Bruce and I were kind of chatting back and forth, the goal would be that we would provide some guidance or information for you to think through potential processes associated with developing that IEP and what potential accommodations could come into play based on that. So I think you're thinking along the right line item, and meeting with that IEP team to make final determinations is a great start.
Okay. What else?
Sorry, I was finally answering that question in the chat. I don't see anything else. We'll be
Katie
back
asked
on Monday.
a late breaking question. Will ODE ever consider removing the vendor component of the vaccine OAR? So one thing, Katie, and again, team, tell me if I'm wrong. The OAR is OHA's OAR. And the definitions of that are set through OHA's rulemaking body. No problem, just being clear so that the venue of, like, there are rules have processes by which they can be engaged and re-engaged. I just want to be clear about that. I don't have any information about that. I understand that our message has been that we don't see a change with the OAR at this time, but Tennille, you might know. I don't know if anyone knows more than that. I guess I would say, Katie, I wouldn't anticipate it in the near future. But checking to Neil Kati or other folks.
No, I don't have anything to add. I think that's accurate as to the best of our knowledge.
Yeah, and hear you on the implications and challenges. We're, think conditions are obviously improving, but that's one of the areas that they want to keep in place. So. Okay. I think we're there, Tennille. Not ignoring you, Charlie. I think we get into the nuances of that same thing Tennille just said, like every school situation, IEP team, context, and maybe rightfully could workshop with each other different details.
Definitely. Well, at a special ed director meeting, we will spend some time holding space for teams to chat. And often there's guidance that maybe I can't give from the state lens, but that colleagues can give. So I'll make sure that at our monthly meeting, we hold space for people to share information and update guidance as we learn and know more. Definitely working with the COVID team and OHA to kind of think through all the opportunities and supports that we can have for our children who experience more severe disability and can't wear masks. Certainly giving wait time for folks. I see we have a number of people dropping off. We don't have any additional information to share. Certainly welcome to stay on and ask more questions. We'll be here, or we'll see you next week. And thank you so much for everything you're doing.
Thank you.
Bye, Morgan.